So, in this part of the lecture, we're going to talk about prenatal development. And as I mentioned to you earlier, developmental psychology focuses on changes across the lifespan. And we said it starts from womb to tomb. So, we're going to spend um, some time talking about the components or sections or periods of uh, prenatal development. And in general, we're going to talk about conception, prenatal development, post-conception, and then the birth process. And then, we'll stop there and then, start talking about birth and physical development and whatnot. But let's begin. The concept of conception is when one sperm penetrates an egg or an ovum, uh, and it fuses together. And when that happens, all other sperm are blocked out. So when you think about it, once one sperm enters the egg, nothing else can penetrate. So they're all blocked out. And then from that point, there's a fusion. Now, we mentioned in the lecture on genetics that half of your genetics comes from that sperm that penetrates the egg, and the other half comes from the ovum or egg itself. So there's going to be a fusion. And then from that point, nothing else can enter. Now, the question is, how do we get twins then? Right? So if only one sperm can penetrate the egg, how do we get twins? Anyone have a sense of that?
Mitosis.
Mitosis is a term used for DNA split. So it's not mitosis. I know why you said mitosis, and I'll explain it shortly.
So it happens when two eggs are fertilized?
Good.
Or when one egg is fertilized, but then it divides a certain way.
Good. Exactly. So the reason why you probably said mitosis, because you're thinking of division of DNA, but it's for identical twins, or what we call monozygotic twins, mono being one, zygote is a fertilized egg. For identical twins, it's one fertilized egg that splits into two. And that's why the genetic similarity is such, right? So it's you have identical twins. Fraternal twins or dizygotic twins is when you have two eggs released from the ovaries instead of one, and both of those get fertilized. Now, that's how we get twins. It's not that more than one sperm penetrated one egg. That's not what's going on here. Can anyone also think of another scenario where you're very likely to have twins, particularly fraternal twins?
In vitro fertilization?
Right on. Good job, Leah. In vitro fertilization is the case, right? Because what's going to happen is that they're going to take several eggs and fertilize them with sperm, and then they're going to implant them. And we're not sure which eggs are going to take and which are not. So they usually do implantation with more than one egg, right? So that increases the odds of having twins, but in particular fraternal twins, right? So just giving you a sense. But at its base, conception is the same, right? So you have to have a sperm penetrate an egg, fuse together with the egg. Now, I use the term implantation because that is a process that needs to happen. So, in the zygotic period, which is from conception to 2 weeks prenatally, the primary goal is for that fertilized egg to latch on to the uterine walls. And what we find is that about half of fertilized eggs don't even make it to that point, right? So it is possible for some that they were pregnant and wouldn't know it. And the reason why they wouldn't know it is because if the fertilized egg, that zygote, doesn't latch onto the uterine walls, it's going to be flushed out as a normal period, right? So keeping in mind that the average cycle is 28 days or so, right? Some people have a shorter cycle, some people have a longer cycle, but on average, it's 28 days. And ovulation occurs uh, roughly in the middle, day 14, day 15. So either it's going to latch on or it's not. If it doesn't latch onto uterine walls, it's flushed out like a period, and one wouldn't even notice it. And if it does latch on, then we have further growth. The embryonic period refers to weeks 2 through 8 prenatally. And here we start to see the outer wall of the zygote from the placenta. We start to see heartbeat and liver functioning. And then the fetal period is from week 9 or the end of week 8 all the way till birth. Now, you might say, well, we have clearly defined markers for the zygotic and embryonic period. Why not the fetal period? The answer is simple, right? Uh, People give birth early sometimes. So we have premature births. And because we have premature births, we cannot be certain that it's going to be 40 weeks later, right? So, um, and then also people might carry beyond 40 weeks, but if it goes to what's called 42 weeks, then we induce labor. So by 6 months, right? So roughly 24 weeks, we have a fetus that's developed uh, long enough or properly enough that it can survive. Now, we do have children who are born before 24 weeks. What we wind up having to do, and even sometimes at 6 months, what we wind up having to do is have that child in what's called the neonatal intensive care unit so that they can grow and develop with artificial support until they're strong enough to function on their own. Now, this slide itself is also an interesting slide when it comes to the debate of abortion, right? So you'll hear different positions as to when an abortion should be allowed or should not be allowed, right? So the first debate or position is never, right? So if you take people who are highly religious, they understand that development begins at conception, right? So if you have the potential for life, right, they're going to say destroying that is murder. Now, so there are other people, though, who will say, no, you can take the morning after pill or whatever it is, and that's perfectly fine because it's still not um, a functioning life force. But by the end of week 8, you have some people who are really bothered by abortion, because at this point you can actually track a heartbeat, you can track liver functioning and whatnot. So there are some people say, hey, even if you were okay with a zygote being a blob of cells, and you could do the morning after pill, or you could do an abortion, that's fine. But by week 8, you have all of your major organs formed in some on some level, and we have heart functioning, we have some brain functioning. So there's a position that says we shouldn't have an abortion after that. And then there's those people who say that they just don't support late term abortion, which is after 6 months, right? So you'll have people say, wait a minute, late term abortion, this child, if given birth to, could survive on their own. So that child should be afforded the same rights as the mother, right? So there are people who take that position, and then there are others who take the position that until the baby reaches um, natural heir, which is birth, that they will allow abortion, um, especially in cases of risk to the mother or others. And there are some states that have late term abortion laws. For example, in New York, you can have an abortion all the way up to birth. And then there are some states who don't allow abortion even earlier than 15 weeks, right? So this is a state to state issue. And it really is hinged upon prenatal development. So it's interesting. You would think, well, our politicians have this opinion or that opinion, but their opinions are formed by their personal philosophies of life and the science of prenatal development. So if you ever wonder, like, well, how'd they come up with that position? Uh, it might be linked to one or more of the understandings of prenatal development. Any thoughts or reaction to that? Okay. So let's talk about how long uh, proper gestation should be. So a normal pregnancy or gestational period should be anywhere between 38 to 42 weeks, which we use the 40-week mark as the midpoint. So if a person discovers that they're pregnant, the first thing they're going to do is go to their OBGYN, and the OBGYN is going to say, okay, when was your last menstrual cycle? And then from there, they're going to take a dial, and they're going to say, okay, 40 weeks from um, conception would be X date. So your predicted due date is such and such date. Now, uh, they're not always correct. Some people are not always careful at attending to their menstrual cycles when it started. So we do have, sometimes it's off a little bit. We also have the fact that some people will um, give birth early or late. So just because it's your expected due date doesn't mean that you're going to hit that date. So it's a range. But if the child is still in utero after 42 weeks, we have to induce labor because the child is too large for the womb, and the child runs the risk of pinching off the umbilical cord, right? So, Ditsia, can you see me after class? Um, but the same thing is a problem if you have a premature birth, right? So anything earlier than 38 weeks, we consider a premature birth, right? So we acknowledge that there's a certain amount of growth that's supposed to happen before birth. But if you give birth prior to 38 weeks, that means that all of that has not happened. We also have something called a micropreemie. A micropreemie is a baby that is born before 27 weeks. So we're talking about a really early birth. Now that happens with people who are older when they become pregnant. That happens with people who engage in substance abuse. And sometimes we have to induce labor earlier due to issues related to the mother or the placenta, right? So there are times when it's appropriate to induce labor even earlier. Uh, but understand that when you do that, you have a child that hasn't fully developed, right? Is not ready to meet the world, so to speak. Now, we also have other terms, small for gestational age, and that's a term that refers to, okay, let's calculate how many weeks the child was in utero and what their expected weight is supposed to be. And if they're underweight relative to the amount of weeks, they're considered small for gestational age, right? So even if you go full term and you're underweight, you might be labeled small for gestational age. Now, what is considered normal weight for a baby? We say normal weight for a baby is 5.5 pounds. Now, that doesn't mean that the average child that's born is 5.5 pounds. The average child born is actually around 7.5 pounds, but we still consider it normal weight at 5.5 pounds. But the technical term for low birth weight is even less, which is a child that's born less than 3 pounds. So these are different terms you want to understand about birth and that process. Now, if you look at the picture on the left, you're looking at a child that is premature, right? And what you notice is that child is hooked up to apparatus. You'll see that they have a nasal cannula to help them breathe because they're premature and their lungs are not developed enough to breathe on their own. There might be IV for fluids because they need nutrition, but they're not able to eat on their own, and so forth. Now, what we do is you might hear the term incubator. There's an incubator or an isolette. That's a more proper term for it, where children who are born prematurely are taken care of. They have a light above them that's a warming light to keep their body temperature correct. They have IV, they have the nasal cannula, they are hooked up to like cardiac apparatus and so forth. So being born prematurely is it's a problem, right? It's a significant problem in general functioning. Now, let's talk about teratogens. Teratogens are harmful agents that can pass the blood-brain barrier and affect the development of the child. And there are all kinds of teratogens. It's any harmful agent. They could be legal or illegal. In this case, I put illegal in parentheses or the ill, because technically they're legal, but they still cause damage to the child. So let's talk about thalidomide. Thalidomide was a medication used to combat morning sickness for expectant mothers. And what we found was that thalidomide caused significant birth defects. So what did they do? They took it off the market. And they said, well, if this nausea pill is going to cause birth defects, we don't want to leave it out on the market. So they took it off. And then they actually put it back on the market. What they realized is that thalidomide could be useful in other populations, right? So if a person has cancer or late stage AIDS, they might have bouts of nausea. And if they're not having children, if they're not pregnant, then this is a really good pill for that purpose. It's a good pill to combat nausea, just not morning sickness. So now we have pills that have what's called pregnancy labels that'll say, do not take if you're pregnant, right, or expecting. Alcohol. Now, alcohol is another one of those things that are legal, but when you're an expectant mother, you don't want to be taking it, right? So alcohol, generally speaking, there's no safe amount of alcohol. So if you look on the CDC, they will debunk some things you might have heard. Oh, there's nothing wrong with a glass of wine. Oh, it's good for the blood. No, there's no safe amount of alcohol. And what we have are, based on the amount of alcohol you drink, you have two different situations that could occur. So if you're a heavy drinker, you could develop something called fetal alcohol syndrome, which affects both the physical and cognitive components of who you are. So physical components might be a cleft lip or palate. So there's a missing piece in the lip. There's widening or separation of the eyes, elongation of the forehead, and so forth, lower birth weight. And from a cognitive point of view, fetal alcohol syndrome also results in intellectual disability, right? So it affects one's IQ and one's adaptive functioning in a really severe way. So you're like, okay, well, that's if I'm a heavy drinker. What if I just have an occasional glass of wine or whatever it might be? Well, we have something called fetal alcohol effects, which is when you don't have all of the features of fetal alcohol syndrome, but you have some of the features. So what the Center for Disease Control has determined, also the American Academy of Pediatrics have determined, is there's no safe amount of alcohol. So I ask you, well, if that's the case, when should one stop drinking? When should one stop drinking?
3 months before getting pregnant.
Okay. But if it's 3 months before getting pregnant, how would you know you got pregnant?
And then right away.
Okay. So the answer, which seems like a, pardon the pun, but a buzzkill, is anytime you're having unprotected sex, you probably should not be drinking, because at any point you could become pregnant. And as I said, when do people notice they're pregnant? What's the earliest time they're going to notice? About 2 weeks later, right? We said that the implantation process happens about 2 weeks later. And if it doesn't take place, it's flushed out as a period. But when a person misses their period, they're like, okay, well, I'm late. What's going on? They might get a pregnancy test. So that's the earliest you're going to notice is 2 weeks later. However, what we find is that some women engage in spotting, which are lighter periods, for the whole first trimester. And if you're exposing a child to alcohol for the first 12 weeks or so, then you really are poisoning the development of the child, and it's going to have profound effects, right? So, that's thalidomide, that's alcohol. Now, it doesn't have to just be alcohol, it could be any harmful agent. So things like cigarette smoking. Cigarette smoking stunts the prenatal growth. It increases heart issues, right? So faster heart rate, you have premature birth, and you have a 5 times more likely case of sudden infant death syndrome, which is an unexplained death in infancy. You have greater risk of asthma and so forth. So cigarette smoking is an issue. We also have issues related to protein, right? Protein deficiencies can lead to an intellectual disability as well. Drugs. So we talked about alcohol. We talked about cigarettes. What about other drugs? Now, illegal drugs, we could be talking about cannabis because it's not legal in all 50 states. That's included in a illegal drug category. We could be talking about cocaine. We could be talking about heroin or any other drug you can think of that is not legal. In general, the pattern is that we have a low birth weight, we have a premature birth, and we have withdrawal. If you were to think of a child that's born and the mother is using drugs, what we tend to see is you can have a child that's born about 2 pounds. We call them kilo kids because they're less than a kilo, and they fit in the palm of your hand when they're born. Now, that child is so underdeveloped that they're not going to go home right away. They might be in the neonatal intensive care unit for months at end. Now, because let's say the mother was abusing, let's say, cocaine, we have to wean that child off of that cocaine, right? So there's a withdrawal process as well. And in the neonatal intensive care unit, we have to give micro doses of the drug so that they don't go through full-fledged withdrawal. So we wean them off. And, that's a sad thing to think about, that this child, even post-birth, has to deal with this. Other things. So we talked about drugs, we talked about legal and illegal drugs, we talked about protein deficiencies. What about radiation? Well, in general, you'll notice that if a person is expecting, their dentist won't see them. They won't do a general cleaning because there are low levels of radiation. Vincent, your mic's hot. So there are low levels of radiation that could cause damage to the child. So even something as simple as an X-ray could cause damage to the child, lead to intellectual disabilities, limb abnormalities, and whatnot. Now, how did we discover the effects of radiation on prenatal development? Well, there are, I see in the chat. Yeah, so no worries. We discovered the effects of radiation due to different points in history. So when the atomic bomb was used in Japan, radiation permeated the soil, right? And for decades later, there was high levels of radiation. Chernobyl, right? The nuclear power plant that melted down led to radiation um, spilling into the streets. And that caused developmental problems, right? So, and then of course, viruses, right? So, viruses can be transmitted. So, if a person has HIV or AIDS, that is a blood-borne disease. And because you're sharing an umbilical cord, you run the risk of passing that from mother to child. AIDS is not the only virus that can be passed on. Um, Herpes is another one. So if a person has herpes, which is a sexually transmitted disease, uh, you'll see that the OBGYN will say you cannot have a vaginal birth, right? There'll be a C-section because that risks exposing the child to it. So teratogens can come in so many different forms. So we typically say any harmful agent. Now, if you were to look at these three pictures, you're getting a picture of what it looks like on the first two of fetal alcohol syndrome, right? You'll notice the elongated forehead, the widening of the eyes, the thinning of the upper lip. Now, in some cases, you can have what's called a cleft palate, which is missing part of the lip. And that's something as simple as alcohol. And I show you, you know, with a child, with an adult, um, the facial deformities that you can see. Now, on the far right, we're looking at radiation exposure, right? So if you look at this person, they're missing an arm. Their legs have not fully divided or separated from one another. So it's almost like a flipper fin, right? They're of notably short stature. And that was due to exposure to radiation. So it's important to talk about when teratogens have their most pronounced effects, right? So the most pronounced effects for teratogens are during the embryonic period. So weeks 2 through 8 are the greatest risk for teratogens. Why not the zygotic period? Why not from conception to implantation? Well, the answer is simple, because if there's exposure to a teratogen, it's going to decrease the odds of implantation altogether. And if you don't have implantation, you don't have a child. So it's flushed out. So we can't talk about teratogens for a hypothetical child. But the embryonic period, look at what's developing. Everything is developing between weeks 2 and 8. So your central nervous system, your brain and spinal cord, that is, your heart is developing, your eyes, your arms, your legs, your teeth, your ears, your palate, your genitals, your brain, everything is developing between weeks 2 and 8. So exposure to a teratogen is going to have the most pronounced effects. Now, does that mean exposure past week 8 is safe? No. You'll notice that some development continues further. Now, let's look at what's happening in terms of the blue versus the green. The blue is what we call primary development, which is essential development of that process. And for many things that happens within weeks 2 through 8, but if you look at the central nervous system, its primary development continues to about week 20. It's primary development. And other things like your ears, your palate, your genitals continue to develop into week 9 and so forth. So that's your primary development. The green is the polishing off or the finishing up of the development of that process. And what we notice is the brain, the central nervous system, develops all the way through birth. So there are other effects that can happen even after week 8. But the most pronounced effects are during the embryonic period because so much is happening. Okay. So that is the prenatal development process. I'm going to pause here and I'm going to show you a brief video and then we're going to talk about newborn reflexes. So give me 1 second to pull that up. So this particular animation is going to show you what happens. We talked about prenatal development and the process of what happens from fertilization forward. So without further ado, let me start the video. What you're seeing here is cell division, right? Because that fertilized egg is going to split until it forms into a proper embryo. You're starting to see the development of the placenta. Now you're starting to see the development of the neural tube, which turns into the brain and spinal cord. And now you're starting to see a very primitive form of a person. All of a sudden, we're starting to have the development of the limbs. You're starting to see at the top the formation of the head, the lips. You're starting to see the development of the arms. You're starting to see the development of the legs. And we're continuing our process. So it's, as you're looking at this animation, now we're not fully through the process, but you're starting to see, hey, through time, the detail of this child or fetus is starting to get more refined and more refined. I'll stop talking briefly. Now you're starting to see the fetus grow exponentially in size. There's a rapid growth. And at a certain point, the fetus is going to be too large for the womb, which is going to necessitate giving birth. So I share with you that video because it's hard to fully capture what's happening in utero, right? So many people will be like, well, I don't see that, but that animation does a really good job at depicting prenatal development from conception to cell division to the neural tube to the formation of the limbs to that exponential growth that necessitates birth. Any thoughts or reaction to that? All right, so let's put a pin in it there, and then we'll talk about the birth process and everything with reflexes.